Hi, my name is Ankit Patel. I'm a surgical oncologist at Roswell Park Comprehensive Cancer Center. HIPEC stands for heated intraperitoneal chemotherapy. It is part of a two-part procedure. The first part actually involves surgery, in which we're removing as much cancer as we can from the abdominal cavity. And then the second part is the HIPEC part, or the chemotherapy part. So at the time of surgery, we actually bathe the abdominal cavity in a chemotherapy solution that is heated. The idea is to kill any cancer cells that we can't see or anything that may have been left behind or is hiding. The combination of the two, the surgery and the chemotherapy in the abdomen, offers us a way to really treat a lot of different cancers and offer a chance for cure for some cancers as well. There are a few core principles that surround HIPEC and heated intraperitoneal chemotherapy. We know through a lot of science and investigation that the peritoneal cavity or the abdominal cavity can tolerate a large amount or a high concentration of chemotherapy without a lot of side effects to the rest of the body and the rest of the organs. So that helps us put in high doses of chemo directly into the belly. But in addition, we've also learned that heat not only kills cancer cells, but it augments that chemotherapy effect. So the combination of the two, the high dose of the chemotherapy, the heated chemotherapy, gives us a maximum benefit of killing as many cancer cells as we can. Cytoreductive surgery and HIPEC can be used to treat a lot of different cancers. The more common ones include appendiceal cancer, ovarian cancer, peritoneal mesothelioma, and in select cases we use it for colorectal cancer that has spread, gastric cancer that has spread. And there's always a consideration for clinical trials for different or unusual types of cancers as well. Cytoreductive surgery and HIPEC can be used for cancers that not only start in the abdominal cavity, such as mesothelioma, but it can be used to treat cancers that have spread from other organs. So, for example, colorectal cancer that has spread throughout the abdominal cavity, or ovarian cancer that's spread, or appendiceal cancer that's spread. So there are a lot of stage 4 cancer candidates that could benefit from HIPEC. Cytoreductive surgery and HIPEC are usually just one part of a complex or comprehensive treatment plan for our patients. The surgery and HIPEC itself can be extensive, and so there can be a significant recovery period, but in the broader picture, the side effects or the recovery time probably pales in comparison to all the other toxicities and side effects that patients would get from continuous chemotherapy or a prolonged treatment journey. Sometimes HIPEC is used to actually shorten that need for prolonged chemotherapy, so it has a lot of advantages despite some of the risks. More importantly, sometimes HIPEC is one of the last treatment options for a lot of our patients. A lot of our stage 4 cancer patients especially, there are not many other options besides prolonged chemotherapy, and HIPEC can be an option to find a different avenue, a different option, a potential cure for a cancer that many would consider incurable. Here at Roswell, we're trying to utilize advancements in HIPEC surgery, including laparoscopic and/or robotic surgery, to perform this procedure as well as the chemotherapy aspect of it. Ideally, this is leading to shorter recovery times and shorter hospital stays for patients. We like to take care of these patients from beginning to end. So not only after the HIPEC or before the HIPEC, but while they're getting their chemotherapy if they need it, or other treatment modalities. We utilize a multidisciplinary approach, and I think that's probably our greatest strength here at Roswell. We've been doing this procedure for over 20 years, and we are a regional expert for this procedure and certain cancer types. In upstate New York and Western New York, we're one of the only places that does this at a high level and at a high volume. For patients to get the best treatment and the best care and the best outcomes, it's really recommended that you come to a place like Roswell to get the kind of care that you deserve.